Call your emergency response number or 911. If the person is on fire, put the fire out. Have that person stop, drop, and roll. Cover the person with a wet blanket. Once the fire is out, carefully remove jewelry and clothing that is not stuck to the skin. Cover the person with a dry blanket. Check for signs of shock. Electricity occurs naturally in the form of lightning or from man-made sources like electric current from an outlet or electrical wire. Electricity can cause burns on the surface and injure organs inside the body. If electricity enters the body, it can cause severe damage. You may see marks or wounds where the electricity has entered and left the body. Injuries from electricity may seem very small, but the electricity can cause damage inside the body and even stop the heart. No one can tell how much damage there is inside the body based on the marks on the outside. If an electrical injury is caused by high voltage like a fallen power line,
Hey, somebody help!
Immediately notify the proper authorities. Call your emergency response number or 911 right away and bring the first aid kit and AED. Don't enter the area or try to pull wires or other materials until the power has been turned off. Don't touch a person if they are still in contact with the power source. Electricity can travel from the source through the person to you. It's best to turn the power off at its source, but only attempt this if you are trained to do so. The switch is usually near the fuse box. When giving first aid to someone with an electrical injury, first, make sure the scene is safe. Get the first aid kit and AED. Wear personal protective equipment. Call your company's emergency response number or 911. When it is safe to touch the injured person, see if he needs CPR. A healthcare provider should check everyone who has an electrical injury. This concludes our discussion of injury emergencies. By now, you should know how to recognize and respond to several common injury emergencies, including bleeding you can see, bleeding you can't see, and shock. You've learned how to recognize injuries to the head and spine, bones and joints, as well as injuries caused by burns and electricity. The video will now pause so that your instructor can go over some of the injury emergency review questions with you. In this part of the course, we'll discuss some of the most common environmental emergencies. Your quick first aid actions can speed recovery and may even prevent death.
Hey, look at that, Tom. There's some little animal over here. Come here, little buddy. Oh, it bit my hand.
Get away from it, Paul. It may be rabid. Look, I know first aid. Let's go to a safe area and take a look at your hand. Wow, it really got you. I'm gonna rinse this wound out with some water. And just later be sure and wash it well with soap and water.
I can't believe it. It broke the skin. It's still bleeding.
I can stop the bleeding with gauze and pressure.
While many bites are minor, some may break the skin, bleed, and become infected. More importantly, a wild animal that bites someone could be carrying rabies. Here are some pictures of some animals that are known to carry this infectious disease. Rabies is quite common in bats. Anyone who has had direct contact with a bat or is unsure whether they have had contact with a bat, such as having slept in a room where a bat is present, should contact a healthcare provider. Follow these steps to give first aid to a person with an animal or human bite. First, make sure the scene is safe. Get the first aid kit. Put on protective equipment. For animal bites, call your emergency response number or 911. Clean the wound with a lot of running water and soap if available. Stop bleeding with pressure and dressings. For all bites that break the skin, call a healthcare provider. If there is a bruise or swelling, place a bag of ice and water wrapped in a towel on the bite area for up to 20 minutes. Snake bites are medical emergencies. You can sometimes identify the snake from its coloration or bite mark. If you're not sure, assume that it is poisonous. Signs of poisonous snake bites are pain at the bite area that keeps getting worse, swelling of the bite area, nausea, vomiting, sweating, or weakness.
Raphael, help! A snake bit me.
Stay back, stay back. It's all right, Carl. Calm down, calm down. Let me look at that. Call 911. See what the snake looked like?
What happens if it's poisonous? What do we do?
Relax, relax. Now, I'm gonna go get this thing washed out. That's why we called 911. We don't know if it's poisonous or not.
Be careful around any snake, even if it's wounded. Back away and go around it. If a snake has been killed or hurt by accident, don't handle it. A snake could bite even when severely hurt or even close to death. It is best to leave a dead snake alone. If you need to move it, use a shovel or another object with a long handle to avoid close contact with the snake. If you don't need to move it, it's best to leave it alone. Some people have heard about other ways to treat a snake bite, but you should follow these steps. Make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Ask another adult to move any other people inside or away from the area and call your emergency response number or 911. Tell the injured person to stay as still as possible, including the injured body part, and try to keep them calm. Remove any tight clothing and jewelry. Gently wash the bite area with running water and soap if available. We have all been bitten or stung by an insect at one time or another. The bite of a non-poisonous insect may cause some discomfort, redness, swelling, or pain at the bite area. The first aid actions for most insect bites are: wash the bite with water and soap if available. Put a bag of ice and water wrapped in a towel or cloth on the bite or sting. Some insect bites can be serious and even fatal if poison or venom is injected into a person or if someone has a severe allergic reaction to the bite. Some people can have a severe allergic reaction to an insect bite, especially a bee sting. People who have had these severe allergic reactions to an insect bite or sting usually have an epinephrine pen and know how to use it. They often wear medical identification jewelry.
Ow! Let me know. Oh, ma'am, are you okay?
I got stung by a bee.
Oh, I know first aid. Can I help you?
Yes.
Okay.
Bees are the only insects that leave their stingers behind. If stung by a bee, you should look for the stinger and remove it. Scrape the stinger and the venom sac away with something hard and dull that won't squeeze the venom sac. For example, a credit card, one edge of a pair of scissors, or the back or dull side of a knife. Wash the sting or bite area with running water and soap if available. Put a bag of ice and water wrapped in a towel or cloth over the area for up to 20 minutes. Watch the person for at least 30 minutes for signs of a severe allergic reaction and provide first aid using the skills you learned earlier.
Good.
The first aid actions for a severe allergic reaction to an insect bite or sting are the same as for any other severe allergic reaction. Make sure the scene is safe. Call your emergency response number or 911 and get the first aid kit if the person has signs of or knows they have a severe allergic reaction to insect bites or stings. Ask if the person has an epinephrine pen. If so, get the pen and help the person use it if you are allowed and trained to do so. If a bee stung the person, look for the stinger. Scrape it away using a dull edge as on a credit card. Wash the bite or sting area with a lot of running water and soap if available. Put a bag of ice and water wrapped in a towel on the bite or sting area for up to 20 minutes. Watch the person for at least 30 minutes for signs of an allergic reaction. The bite of non-poisonous insects cause mild signs of redness and itching at the bite area. The bite of a poisonous spider or scorpion, on the other hand, causes general illness. Signs of poisonous spider and scorpion bites are severe pain at the site of the bite or sting, muscle cramps, fever, headache, vomiting, breathing problems, seizures, or does not respond. If you know that a person has been bitten by a poisonous spider or scorpion or has any of these signs after such a bite, then do the following. Make sure the scene is safe. Call your emergency response number or 911 and get the first aid kit and AED. Wash the bite with a lot of running water and soap if available. Put a bag of ice and water wrapped in a towel on the bite. Be prepared to check to see if CPR is needed and give CPR if you know how. Ticks are found in wooded areas. They attach themselves to exposed parts of the body. Many ticks are harmless. Some carry serious diseases. If you find a tick, remove it as soon as possible. The longer the tick stays attached to a person, the greater the person's chance of catching a disease. To remove a tick, grab the tick as close to the skin as possible with a tweezers or tick-removing device. Try to avoid pinching the tick. Lift the tick straight out of the skin without twisting or squeezing its body. If you lift the tick until the skin tense and wait several seconds, the tick may let go. Wash the bite area with running water and soap if available. If you are in an area where you know that tick-borne illness exists, suggest that the person see a healthcare provider and place the tick in a plastic bag to take with them. Heat-related emergencies can result from exposure to extreme heat outdoors or in the workplace. These emergencies range from mild to life-threatening. You should try to recognize and give first aid for heat-related emergencies early because someone with mild signs can get worse quickly and develop a dangerous condition called heat stroke. The mildest form of heat-related emergency is called heat cramps. Signs include muscle cramps, sweating, and headache.
Clint, you okay, man?
Man, I feel awful. My leg hurts, my stomach hurts, my head's just throbbing.
Well, I know first aid. You want me to help?
Yeah, please.
Man, looks like you're getting overheated. Jeff, grab the first aid kit out of the van.
You got it.
Alan, grab a sports drink from the ice chest. Oh, and bring back some ice and water in one of those plastic bags next to the chest, okay?
Okay, you got it.
Okay, first thing, we need to get you over to the shade. If I help you, you think we can make it to those trees?
Yeah, sure.
Okay, you ready?
Yep.
All right, there we go. Okay. You think you can swallow a sports drink? It's got electrolytes and sugar in it. Make you feel better.
Sure.
Okay. You said your leg was aching. Is it okay if I put a bag of ice and cold water on it?
Yeah, please.
All right. There you go. Set it down.
Oh, yeah.
All right.
That feels better already.
Okay.
Thanks.
Actions to help someone with heat cramps include: be sure the scene is safe. Send someone to get the first aid kit. Wear personal protective equipment. Have the person with heat cramps rest and cool off. Have the person drink something with sugar and electrolytes, such as juice or a sports drink or water, if these aren't available. If the person can tolerate it, apply a bag with ice and water to the cramping area for up to 20 minutes. A mild heat-related emergency can get worse if left untreated. And mild heat-related signs are a warning that someone may get worse unless you take action. Heat exhaustion is a more serious condition that can often turn into heat stroke if not treated. The signs of heat exhaustion are nausea, dizziness, vomiting, muscle cramps, feeling faint or fatigued, or heavy sweating.
Right.
They're going to be taking that all the way inside.
Going all the way to the back room there?
There should be another box that has all the
The Fabergé eggs.
all the way in. That's the box.
All right.
The
Okay,
one,
so
and
that's that one right there. Okay. So we
want
only
that
should
one.
have about 3 or 4 more boxes, and
Right,
then
so
we're
that
gonna be
one, I'm
good
gonna
for
have
the day.
Take that one all the way up. Yeah, and then we'll get the rest of the box.
Greg, are you okay, man?
So hot.
So, okay, I know first aid, so I can help you. All right?
Yeah.
What's the matter?
My leg's cramping.
Is he okay?
I don't know.
Donovan, can you go get the first aid kit out of the cab of the truck?
Is there anything I can do, Damon?
Yes. Can you call 911 and tell them that we have somebody with a heat emergency?
Absolutely. You know, you might bring him inside because it's a lot cooler in there.
That's a good idea. Can you help me up? All right. Let's get him up. Let's go. Come on, Greg. Almost there, man. All right. Here we go. There we go. Great. Donovan, check with Miss Dawson, see if she has any spray bottles that we can put some cold water in.
Sure, boss.
Corby, can you check the cooler outside and see if there's any sport drinks left?
You bet.
Okay, Greg, we need to get as much of your clothes off as we possibly can. We're gonna start with your work shirt, your shoes and socks. Gonna need you to work with me here, though. All right, here we go. Here we go. Right. Okay.
Here's a spray bottle with some cold water in it.
All right, great, thanks. Now I'm going to spray you with some water. It'll help. I'll lift you up a little bit and get back in.
Here you go.
Greg, do you think you can drink something?
The dispatcher said EMS will be here in just a few minutes.
Actions to help someone with heat exhaustion include: be sure the scene is safe. Send someone to get the first aid kit and AED. Wear personal protective equipment. Call your emergency response number or 911. Have the person lie down in a cool place. Remove as much of the person's clothing as possible. Cool the person with a cool water spray. If a cool water spray is not available, place cool, damp cloths on the neck, armpits, and groin. Have the person drink something with sugar and electrolytes, such as juice, or a sports drink, or water if these aren't available. As we mentioned earlier, heat stroke is a very serious condition that looks similar to heat exhaustion. However, heat stroke is life-threatening, and you'll need to act quickly because a person with heat stroke can die. The signs of heat stroke are confusion, passing out, dizziness, and seizures. Other signs are similar to those for heat exhaustion: nausea, dizziness, vomiting, muscle cramps, feeling faint or fatigued.
Okay, stand back, please.
We were sitting at that park bench and saw him just fall over.
What's wrong with him?
He's soaked wet.
You think he's overheated?
Could be. Either one of you have a phone?
Yeah, I do.
Good. Call 911.
What happened?
Sir, can you hear me?
I gotta get oh my God.
Let's see if we can get him to the pool. If he's going to a heat stroke, we gotta get him up.
Sir, we need to get you the water, okay? Can you try to stand up for us?
Randy, could you go get the first aid kit and the AED out of the van and bring a sports drink from the cooler? You bet.
Actions to help someone with heat stroke include: be sure the scene is safe. Send someone to get the first aid kit and AED. Wear personal protective equipment. Call or ask someone to call your emergency response number or 911. Put the person in cool water up to his neck if possible. See if the person needs CPR. If he does, give CPR if you know how. It's important to begin cooling a person who might have heat stroke immediately. Every minute counts. If you can't immerse the person in water, try to cool him with a cool water spray. If the person starts behaving normally again, stop cooling him. If you keep cooling the person, it could actually lead to low body temperature. If the person can drink, give him something to drink. A sports drink is best. If he can't drink because he's having a seizure or vomiting, for example, wait for someone with more advanced training to take over. Cold-related injuries may involve only part of the body or the whole body. A cold injury to part of the body is called frostbite. Cold injury to the whole body is called low body temperature or hypothermia. Frostbite typically occurs outside in cold weather. It can also occur inside when workers handle cold materials, such as cold gases under pressure, without wearing gloves. Signs of frostbite are: the skin over the frostbitten area is white, waxy, or grayish yellow. The frostbitten area is cold and numb. The frostbitten area is hard and the skin doesn't move when you push it. When giving first aid for frostbite, move the person to a warm place. Call for help, remove wet or tight clothing, and pat the body dry. Put dry clothes on and cover with a blanket. Also remove any rings from a frostbitten part. There are some things you shouldn't do for frostbite. Don't try to thaw the frozen part yourself if you think there's a chance of refreezing. If you need to touch the frostbitten area, do so gently. Rubbing it may cause damage. Low body temperature, or hypothermia, occurs when body temperature falls. This can cause serious problems or even death. A person can develop low body temperature even when the air temperature is above freezing.
Hey! Who left the delivery in front of the freezer? You blocked the door! Hey! Someone call 911! Grab the first aid kit and the AED, get some blankets from the dry storage.
The signs of low body temperature include: the person's skin is cool to the touch. Shivering. Keep in mind that shivering stops when the body temperature is very low. The person may become confused, have a change in personality, be very sleepy, or not concerned about his condition. The muscles become stiff and rigid. and the skin gets ice cold and blue. As the person's body temperature continues to drop, it may be hard to tell if the person is breathing, or the person may stop responding. The person may even appear to be dead. First aid actions for a person with low body temperature are: get the person out of the cold, remove wet clothing, and pat the person dry.
Get this wet jacket off her.
Put dry clothes on and cover the person's body and head, but not the face, with blankets, towels, or even newspapers. If the person stops responding, call your emergency response number, or 911, and get the AED. Be ready to check to see